So today we're going to go over sciatica and the 3 things that you should not be doing if you believe you have sciatica or you have been told you have sciatica. We're talking buttock, leg pain, calf pain, numbness, tingling, those types of things. If you have those types of things, these 3 tips of what not to do are going to apply to you, and they're going to help your recovery process and help you just have a smoother recovery and just have a more enjoyable recovery. And you're going to have more predictability of your pain and discomfort, which is key, right? If we know exactly what it's going to feel like and the things that we should and should not be doing, that's just going to make the recovery that much more enjoyable. So if you have sciatica, I guarantee at least one of these tips is going to resonate with you. But before we waste any more time, let's go over those tips right now. So as a concierge physical therapist, I have the ability to work one-on-one with my patients. And when I'm working with them and they're trying to get over sciatica, the first tip that I tell them that they should not be doing is laying around. Intuitively, we think that our body needs to rest and recover, but nerves need 3 things. Nerves need space, movement, and blood flow. Once they have those 3 things, they're going to be feeling better. Well, the space is most likely involved in reducing the space around the nerve from either like some bone or a disc material or a herniation or a bulging. And when you have that, the nerve becomes irritated. So you have to rely on movement and blood flow to nourish that nerve. And so the movement comes from moving and the blood flow also comes from moving. So when I work with my patients who have true sciatica, the thing that they have in common is that they feel better when they move. And when we look at the research, that's the number one thing that we should be doing, promoting an active recovery for that nerve. And so I tell them, you got to get up and walk, whether that's 5 minutes or every minute or every commercial break. You just got to get up and walk around. You got to help that nerve nourish itself and just provide an environment for that nerve to heal. So number 1 tip would be, don't sit around. You cannot sit around. You need to get up and move. Walking is a great way to do that. Walking is typically better than riding a bicycle or getting on a stationary bike. Extension tends to feel a little bit better, so get up and walk. 15 to 20 minutes is great, but even 1 to 2 minutes is absolutely fine. The second thing that I tell them they should not be doing is exactly what I'm doing right now, sitting on a soft surface. I promise you that if you have true sciatica, sitting on a soft surface, such as a couch, can be deadly. The nerve does not like that. When you sit on that couch, it promotes a flexion environment for the lumbar spine, and that flexion typically opens things up and moves the disc material posteriorly or towards the nerve, which can cause some irritation right away. So my patients who have true sciatica really don't like bending over, and that bending over translates to sitting, and especially sitting on a softer surface. So you're going to want to sit on a harder dining room chair, or if you're in your car, you got to have something in the small of your back to promote that extension, or just stay in a little bit more of that extended position because your body prefers that position. It doesn't provide extra pressure on the nerve, which at first can be really bothersome. So number 1 thing would be you got to get up and move. Number 2 would be you cannot sit on a soft surface. If you are sitting on a soft surface, you're either going to have pain in that moment, or when you go to stand up, things are not going to feel great. I know that some of this stuff is resonating with you, especially if you have a history of sciatica. And so just avoid sitting on a soft surface and sitting for a long period of time and not moving. You got to get up and walk. Now, the third thing would be, as you're starting to feel better, doesn't mean you are better. And so with my patients, when they're starting to have some recovery from sciatica, then they start to resume their normal daily activities, and then they go to bend over and pick something up. When you bend over, that's flexion, and when you pick something up, that increases the intra-abdominal pressure, which increases pressure on the nerve. So you combine those 2 things, and if you are not better, you're going to feel it. And oftentimes sciatica is caused when you go to pick something up heavy and generate strength from a flexion position or bending over. Just because you are feeling better doesn't mean you are better. And the last thing to get better in sciatica is the leg pain and the ability to bend over and pick something up and generate strength from a lower or a flexion position. And so if you do that, you could cause an increase in symptoms. Now, with all of the things that I've talked about today, those things that you should be avoiding, if you do that and you do have an increase in discomfort, it doesn't mean you're making your sciatica worse, or you're causing nerve damage, or you're causing a greater herniation. That's not how it works. Your body's experiencing symptoms from the cause of the symptoms. And so the symptoms being your pain, your leg pain, your glute pain, your calf tingling, that type of thing. And so if you're having an increase in symptoms, doesn't mean that you're getting worse. It just means that we're kind of of prolonging the healing process. And so when you consider those things that you should be avoiding, if you listen to those things and every day you incorporate just that knowledge into your daily activities, you're going to make that recovery process that much better. And so you can just have a little bit smoother of a recovery. But when you have sciatica, it's completely normal to have ups and downs as you recover. But when you incorporate those tips, the pathway to your recovery should just be a little bit more enjoyable, and you can just have a little bit more confidence in your body healing. I hope you guys found these tips helpful and that you can include them in your day. And just, I know at least one of those resonated with you if you really have sciatica. But when you really are looking for somebody to help you along that pathway of recovery, try teaming up with a physio or a physical therapist to help you with that, because your nerves and your body just needs to heal. To regain the ability to pick something up from the ground and generate strength can be something that you can work on with a movement professional with. And so just keep that in mind. But the sciatica does get better. The recovery is, it will happen. Just hang in there, but incorporate those 3 tips to help you along the way. If you guys like what I'm talking about, just please subscribe to the channel or leave a comment underneath the description to see if you found this useful. But I will keep putting out a good sciatica material to help you guys recover and just make this recovery process that much more enjoyable. But as always, guys, stay healthy, keep moving, and take care of yourself.